Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper jaw for implant placement. This is the panoramic view. So there are multiple bridges that this patient has. There are edentulous areas in the upper left first premolar, the upper left lateral, the upper right lateral, and the upper right first premolar, and the upper right first molar region. Now we've gone ahead and measured all these areas for our doctor. So starting with the upper left first premolar region, we've got 4.2 millimeters of ridge width with 12 millimeters of height. The bone quality here is D2. Moving to the lateral incisor, we've got approximately 3.6 millimeters of width with 13 millimeters of height. So we've got a thin ridge here. The bone augmentation is advised in this region. The next we have is the upper right lateral incisor. Again, very thin ridge. You've got 4 millimeters of ridge width with 13 millimeters of height. So here a thin implant can be placed, but again bone augmentation would be advised. You've got D3 quality of the bone. Moving to the upper right first premolar region, we've got 7.5 millimeters of width with 13 millimeters of height, and here an implant placement will be absolutely no problem. Moving to the upper right first molar region, this is grafted bone, so this bone quality is going to be D3 to D4. We've got 12 millimeters of width with 9.6 millimeters of height, so we're presuming there's been a slight sinus lift because there's detachment here of the cortical plate. So we've got 9.6, so a shorter implant can be placed here, but the implant should be placed buccally, not palatally, in order to engage with the grafted bone. So this is what we've seen. This is the axial view for the doctor. We'll place neobiotic implants and show you the areas where implant placement is possible so that doctors can see. Thank you very much.